Good evening, everyone, and welcome to our town hall with the Virginia Department of Health to talk about how we keep everybody healthy this winter. We know there's lots of stuff going around, of course, COVID, but also RSV, and we'll learn more about what that is, and the flu, which has been around for a long time and is still giving us grief here in Richmond. So real excited to dig into all of this and learn all the great tips we can to make sure we have a very healthy winter season. We keep all of our kids in school, all of our teachers teaching, and keep everything moving with health and with happiness throughout the holiday season. So we're about to get rolling here. Before we do, I just wanted to pause and honor the late Congressman Donald McEachin, who was such a dear friend to Richmond Public Schools, to me personally in my role as superintendent. And I'd like just to take a moment and ask Nikisha White, who is our coordinator of health services here at RPS, to share a little bit of additional information about Congressman McEachin's support of public health. Nikisha, do you want to jump in?
Sure. Thank you so much, Jason. Good evening, everybody.
I think you're on mute.
Oh, am I unmuted now? Can you hear me? Still can't hear me?
I can hear you, Keisha.
Oh, okay.
Go for it.
Okay. Thank you, Jason. Thank you, Jason, and good evening, everybody. I just want to share a quick story about Senator McEachin. A while ago, a couple of years ago, I was in the master's program, and one of my assignments, we had to interview a lawmaker who had passed a law that had a significant impact on health. And I immediately thought about the non-student specific epinephrine law that was in Virginia schools. And I emailed Senator McEachin, and his team responded to my email almost immediately. And I was able to interview him, which was fascinating because he got to walk me through the bill process from the inception of the bill all the way to the passing. And I missed a part in the story. The bill was passed because unfortunately we lost a child in another county because the child had experienced an allergic reaction during school hours. So this child's parent fought very hard and worked with Senator McEachin, and he worked very diligently with the parent to get this bill passed. And they ended up getting bipartisan support. And because of his hard work, we have non-student specific epinephrine in all of Virginia schools. And I just wanted to say that I think I speak for all the school nurses across the Commonwealth that his significant work and dedication had a huge impact on school health, and we really do appreciate it. And thank you, Jason, for the opportunity.
Thank you, Nikisha. And again, thank you to Congressman McEachin for his leadership, and our deepest sympathies to his wife, Colette, who's the Commonwealth's attorney, also a dear friend of RPS, and to the entire McEachin family. Before we move forward, I want to make sure we get our interpretation announcement. So Tom, why don't you go ahead and do that?
Okay. Welcome, everyone. We want to share with the Spanish-speaking community that interpretation services are being provided in Zoom for this meeting via a separate audio stream. For those who are entering via computer, use the round circle world to choose the language, EN for English, ES for Spanish. If you are accessing this meeting via a mobile phone, please click your meeting options and select Spanish. Bienvenidos a todos. Le informamos a la comunidad hispanohablante que para acceder a los servicios de interpretación deben elegir el idioma al momento de ingresar a la reunión. Para aquellos que estén ingresando vía una computadora, utilicen el círculo redondo mundo para elegir el idioma, EN para inglés, ES para español.
Thank you, Tom. We appreciate that. And now we can get rolling. You've all met Nikisha White already, our coordinator for health services here at RPS, who oversees our nursing program and has been instrumental in helping us make our way through the pandemic for 3 years now. It's kind of unbelievable, Nikisha, but we are so, so grateful to you. and your team. We are also joined by Dr. Tiffany Kimbrough, who is the Director of the Mother-Infant Unit at Children's Hospital of Richmond. Thank you for being here, Dr. Kimbrough. And Dr. Elaine Perry, who is the Director of the Richmond and Henrico Health Districts. Thank you, Dr. Perry, for being here as well. All right, I am going to just give a quick overview of our objectives for tonight. You know, we're a school system, so we got to have lesson objectives. So 3 objectives. Number 1, so that folks watching tonight understand the primary respiratory illnesses circulating this winter and why vaccinations matter for those. So that's number 1. And again, COVID, RSV, and the flu. Second, what you can do to keep your student and your family healthy through the holiday season. That is so important. It's great to get together with family and friends, but you won't be able to do so if you are not well. So tips to stay healthy. And then finally, how to plan for a healthy and safe winter break, which is coming up in just a couple of weeks. We want to make sure everyone stays healthy through the break and then is ready to come back refreshed and healthy and rearing to go in January. So those are our objectives. And to kick us off with some critical information is Dr. Kimbrough. Thank you.
Thank you so much, Jason, for that introduction. So as mentioned, I am a general pediatrician at the Children's Hospital of Richmond at VCU. I'm also a mom of 2 littles, including one that is in school right now. So we are following some of these tips to try to stay safe and healthy. I'm going to cover the main illnesses that are circulating right now. So again, COVID, flu, and RSV, and talk a little bit about what we're seeing right now at the Children's Hospital. Go to the next slide. So luckily, we have seen our numbers for COVID-19 decrease from last year, where the Omicron variant was really the predominating virus that was circulating. But we have seen some newer subvariants that have come out, and they are still pretty contagious. So this unfortunately hasn't gone anywhere in the last 3 years. I know we all keep hoping that COVID-19 is just going to magically go away one day, but it's still here with us. I do have a couple of children that are admitted over in the inpatient unit right now with COVID-19. So while we think of it as not being quite as severe, especially in little ones, it is something that does impact those that are immunocompromised, particularly causing more severe disease. So hasn't gone away just yet. And we're also learning more about what are the long-term effects of COVID-19. We're actually one of the study sites here at VCU for long-term COVID in kids. And we're seeing some children that do have lingering effects after their initial acute infection. So some kids that have difficulty concentrating, some kids with new headaches, some kids that really don't tolerate standing for very long before they feel dizzy, and then other kids that have longer term cough. I have a few children that really are still needing a lot of respiratory support even months after their initial infection. What we are seeing a lot right now is flu, or influenza as we call it, and RSV, or Respiratory Syncytial Virus. And these are typical things that we see in the fall and the winter. But what's different about this season is that both influenza and RSV got an early and really rearing start. So they both increased really quickly around the same time. And the unfortunate part of that, it was the kind of perfect snowstorm to kind of overwhelm not only our local emergency rooms and hospital systems, but really seeing this trend nationally, where a lot of pediatric services are just really being overrun with an early start to the respiratory season. We've been operating at 95% capacity for weeks. We've been on ambulance diversion, meaning we can't take kids into the hospital for even non-respiratory illnesses. So if a child's in a car accident and they need to come in and get trauma care, if we're on diversion, we can't accept them here at the Children's Hospital. So every day we have a huddle with all the local pediatric service hospitals to figure out who has bed capacity, who's able to take patients. And we're seeing this across the whole Commonwealth. We've even started rescheduling some of our well checkups. And this might have impacted your family where your child was scheduled for their typical checkup, and we've deferred those visits for a few weeks to try to make space for how many children just need sick level of care. And many of the area practices are doing this to try to make sure that we keep kids out of the emergency room who can be seen in their primary care office and leave the emergency rooms open for those kids that really need higher levels of care. We can go to the next slide. This is just a visual representation of what COVID-19 has been doing for the last year. So starting on the left of the slide, we have November of 2021 going all the way to current state on the right side. And as we all remember, last winter, we just saw a lot of COVID-19. And then we were able to see that kind of decrease into the late winter, and now coming into our current season, the levels have been pretty stable. So we're not seeing big increases, but again, COVID-19 hasn't gone away. It's still part of our environment. I'm going to the next slide. This is what we're seeing currently with influenza and over a similar time point. So on the left, November of last year, moving forward to current. The past 2 years, we've been pretty lucky with our flu seasons being relatively mild. But again, starting a few weeks ago, we started to see in those red dots just the rapid increase in influenza cases that we don't really feel like we've hit our peak just yet. We're still seeing a lot of kids that are coming in with flu. So when we do our nasal swabs, the percentage of kids that are coming in that are positive for flu is 45%. So almost half of the kids that are coming in sick right now have flu. Going on to the next one, this is RSV trends. So again, that respiratory syncytial virus really was very quiet for the last 2 seasons. And then we saw just a rapid early increase really at the end of the summer for RSV. And this typically impacts our kids less than 4 years of age in terms of needing to come into the hospital for breathing support. And Dr. Perry is going to go into this a little bit more, what RSV looks like. We'll go on to the next slide. So again, to hit back on COVID-19, we think of it as not impacting kids quite to the same extent as adults, but we do know it still does impact them to the point where COVID-19 actually made it onto the top 10 list for cause of death for pediatrics. We know kids aren't supposed to die. They're supposed to live long, full, healthy lives, but we see them impacting their health, but also their education. So COVID-19 diagnosis is going to lead to kids having to miss school, and they've already had to miss so much. Missed out on those social connections, so their after school activities, and then additional physical activities. Again, I've seen a lot of kids just not really even be able to tolerate their same level of physical activity after a COVID infection. For those kids that do end up in the hospital, this is again another disruption for them, and we're seeing a lot more hospitalization still in those folks that are unvaccinated. And then we have seen those complications that are rare, but still quite serious, of the MIS-C, or the multi-inflammatory syndrome in children. So after a COVID-19 infection, kids becoming quite sick as their immune system becomes hyperactivated. You know, vaccination is still one of the best ways that we have to help keep kids safe and healthy. And the way that I like to describe vaccination for COVID-19 specifically is to think about it like a seatbelt, or like your car seat if you have littles that are still using those. We might not necessarily prevent the car accident itself by using our seatbelt, but we are going to prevent injury and severe outcomes. So that vaccination really is a tool in our toolkit to help keep our kids safe and healthy. Go to the next slide, and I think I'm turning it over to Dr. Perry.
Yes, hello. Thank you so much, Dr. Kimbrough. And thank you all for joining this evening. So I'm going to talk a little bit about some ways that we can help keep ourselves and our loved ones healthy during the holidays. And so we're going to talk about, first of all, some very general preventive messages. So the things that we always from public health talk about to do to help keep us protected against a whole host of respiratory illnesses. We're going to talk about keeping up to date with vaccinations and boosters. Talk about staying home when sick, which is very important. And then also talk a little bit about testing for some of these different respiratory illnesses if it's your children or you start to have symptoms. So going to the next slide. So the first thing it's important to remember is that there are some basic public health precautions, guidance, things that we've been saying for years and years and years and years that are still true, right? So things that we can do to help protect us from a whole host of different respiratory viruses. And so we do start off, and we'll end this talk with vaccination, right? So we do fortunately have vaccines that are safe and effective, available for flu and for COVID. So it's important to make sure that we're up to date on those. And I'll talk more about that in another slide or two. But the things, again, the tried and true methods of public health prevention, washing hands, that is so important to do now as much as ever. Other things that we talk about often are ventilation. So good airflow, you know, if you have to be inside with a lot of people, having improved ventilation, having those windows open is very helpful. Or even better, if the weather allows, gather outside. So some of these times that we're able to finally get together back with family and friends, if weather permits, to try and have some of those activities outside where, again, there's better air exchange and much less chance of people coming in contact with other respiratory viruses. So wear a mask when needed. There are still recommendations to wear masks in certain circumstances, particularly if we're looking at higher community levels. But even regardless of the community level, if you feel that it's best for you or your child to wear a mask, that is absolutely fine. If you're in a circumstance where you're visiting people who are maybe have problems with their immune system and you want to have that extra layer of caution and protection, that is fine as well. And so we do want to keep, again, Dr. Kimbrough talked about toolkits. Masks are still in our toolkits, particularly as we're heading into the winter season here. And then finally, and I will talk about this a little bit more, so important that we stay home and we keep our children home when they are sick. That is a key method to help prevent disease transmission. So going on to the next slide. So vaccination, right? It is so important that we do keep up to date with our vaccinations and keep our children up to date with their vaccinations and boosters, all of the recommended vaccines. But what we're going to focus on right now specifically are the vaccines for the 2 respiratory illnesses that we're talking about, that there are vaccines, right? So we'll start with COVID-19. COVID-19 vaccines, many millions of doses administered in the US and throughout the world. These vaccines have been shown to be safe and effective. Getting your child vaccinated is easy. Vaccines are offered in many locations, and it can really help protect your children against serious illness. Right now, COVID-19 vaccines are available and recommended for everyone ages 6 months of age and up. So talking a little bit more about boosters and COVID-19 vaccines on the next slide. So again, the best defense is a good offense when it comes to protecting ourselves against respiratory illnesses. So, again, the COVID-19 vaccine is really the best way to help protect against severe illness from COVID-19. All those other things are important, but vaccination is really important too. The relatively newly formulated, the bivalent booster that we've been talking about a lot, targets both the original wild type strain and the Omicron variant. And so this is expanded protection. It's enhanced protection against the COVID-19 strains that are more commonly circulating right now in our communities. These boosters, these bivalent boosters, are available and recommended for everyone aged 5 years of age and older. So that's really important for those of you with school-age children to make sure that they are getting their bivalent booster. And then, it really is important. It has been a long pandemic. Many of us got vaccinated quite some time ago now, and we do know that our immunity to COVID-19 from both disease and from vaccination will decrease over time. We call it waning immunity. And so that's another reason why it is really important that now that this bivalent booster is available, that we get that because that will help literally boost our immune system. It enhances our immune response, and that will help protect us, particularly going into the winter season here. And so where to go for vaccines? The primary series and the boosters are widely available. They're available through the local health departments, different events that we have, community providers, healthcare professionals, pharmacists, and then even there are after-school clinics with Richmond Public Schools that we'll hear more about later on this evening. So I know, I'm a parent as well, right? And we always are concerned about what we're doing with and for our children. And so thinking about the benefits and risks of everything that we do. And so taking a moment to talk about the benefits and risks of these COVID-19 and other vaccinations that we've talked about. So the benefits are that these vaccines do help protect our children from very serious illnesses. As Dr. Kimbrough mentioned, she is still seeing patients, she's still seeing children in the hospital currently with COVID-19. The Virginia Department of Health just released a press release today saying that unfortunately, we have now seen our first child die of influenza. So our first pediatric influenza death, this influenza season just occurred very recently in the southwest part of the state. So this is serious illness that we're talking about. And so these vaccines really can help prevent that very serious illness. So these vaccines reduce the risk of hospitalization. They reduce the risk of spread to others. So we're helping protect the people that are vaccinated and then the people who are around those people that are vaccinated. And again, reduced risk of death, serious illness up to and including death is very, very important to remember here. I am not saying that there are no risks associated with vaccination. Yes, we understand that, right? They can hurt, there can be swelling. We do expect and we do see mild side effects with COVID-19, influenza, and all vaccines, right? And very, very rarely there are more serious adverse events. But when you look at, I love the graphic here of the teeter-totter, right? When you're looking at the benefits compared to the risks of vaccination, in children, we feel very strongly that the benefits do outweigh the risks to help protect against these very serious illnesses. So we're going to switch gears a little bit and talk about flu. So fortunately, there are vaccines also against influenza or the flu, so the flu shot. Getting your annual flu shot really is, again, the best way to protect yourself against seasonal flu, seasonal influenza. The good news is that this year so far, it's still early and I've got fingers and toes crossed, but it looks like the flu vaccine that we're using this year, it looks like it's going to be a good match for the type of influenza, the type of flu that's currently circulating in our community. So stay tuned. It's too early to declare for sure, but so far, it looks like it's going to be a good match. So definitely make sure that you're getting your yearly flu shot and that your children are getting their yearly flu shot. Again, remember, as young as 6 months of age is recommended to get an influenza vaccine. So flu shots are free and available at our health department clinics. There's walk-up opportunities, there's scheduled appointments. And then again, there are many different opportunities in the community for people to get vaccinated against flu, whether it's going to a pediatrician's office, family practitioner's office, and some pharmacies, to go ahead and get yourself and your children vaccinated. Talking really quickly about flu, testing for flu as well. So there are tests available. So you can go to a healthcare professional and get tested to see if you have influenza. There are some at-home flu tests available over the counter at pharmacies. And then there are actually some tests available that test for both flu and COVID-19 at the same time. So with one test, they're looking for both of those different viruses. So again, it's important to get tested if you're having the significant symptoms to see if you have flu or COVID-19. Okay. And then again, talking of the third virus that we're talking about this evening, as Dr. Kimbrough mentioned, so Respiratory Syncytial Virus, or RSV. So this is a virus that unfortunately there is not a vaccine for. And so we fall back on our traditional tried and true methods of helping prevent this illness in terms of hand washing, cleaning surfaces, making sure that your child gets tested. There's not a vaccine for RSV, there are tests for RSV. So that's a way that you can be diagnosed. And again, as Dr. Kimbrough had alluded to early, usually the most severe disease that we see relating to RSV is in very small children, but it can be very severe, right? You can end up having bronchitis, pneumonia, particularly in children who have problems with their immune system. Now, we know, though, that RSV can also cause severe disease, severe illness in people who are older who have problems with their immune system. So as with many diseases, we worry about the very youngest and the very oldest when we're talking about different respiratory viruses in particular. And so again, the best way to protect, to understand your risk, and follow those good public health practices that we recommend. So switching to the next slide. So I had promised I was going to talk about staying home with sick, and this is where we have a whole slide on this. So again, I'm a mom. I know it's really tough, as a working parent, when your child is sick and you've got to stay home with them. I completely understand that can have really significant implications, but I really do want to make a strong case for all of us to stay home when we are sick. It really is the best way to reduce the risk of spreading, particularly these respiratory illnesses, these respiratory viruses that we're talking about, whether it's flu, COVID-19, or RSV. There's an element here of being socially responsible, right? Don't chance it. If you're not feeling well, if you're feeling sick, if you're coughing, you're sneezing, your children, and they have a fever, they're again, same things, they're having these symptoms. It really is important to have them stay home so that they don't spread what they have to other people. And again, this is part of the way that we're trying to set us all up for success so that we can still have a great time, a wonderful time with our families over the holidays. And then, as mentioned earlier, that everybody can come back to school then when the holidays are over and get a great start in January. So testing is important. I've already mentioned that. Talk about that again. Tests are available for all three of these viruses, and sometimes it's hard to tell the difference between them. And so that's why going to a healthcare professional and getting that diagnosis, can be really important. There are opportunities for free at-home COVID tests that you can pick up through the schools, through some of the libraries, and then through some of the health department events that we have out and about in the community. And so even if you have a negative test for one of these viruses, if you're still feeling sick, it is worth getting tested for the others as well. Because, again, if it's not COVID-19, it still could be flu, or if it's not flu, it still could be RSV, and particularly the smaller children. And so it is really helpful to get an accurate diagnosis for people who are really feeling sick and have significant symptoms. All right, and that is it for me, and I'm going to turn it back over to Nikisha. Thank you.
Thank you, Dr. Perry. Winter break is on the way, and we want to make sure that you are engaging in overall wellness. The last day before break is December 16th, and we return to school January 2nd. Yay. We want you to go into the holidays with a peace of mind by getting your COVID-19 booster shot and start the new year off with a resolution to begin your primary series if you haven't yet. Be sure to get your flu shot too. RPS has free at-home COVID-19 tests to take home over the break. You can get these by reaching out to your school's nurse or the school front office. You can find local COVID-19 vaccinations throughout the community and in upcoming clinics at Richmond Public Schools. Next slide, please. 5 things parents and guardians need to know. Vaccines are safe and effective. Vaccination protects your child, family, and community. COVID-19 and flu vaccines are free and readily available. Vaccination allows children to attend school and other activities. Children can get the COVID-19 vaccine with their other routine immunizations. So how can you prepare your child for vaccination? Give your child time to process the information and also give them time to ask questions they may have about the vaccinations. For teens, you may want to prepare them a week or 2 in advance. For older school-age children, a few days in advance. For younger children, 1 day in advance. You want to explain the vaccination. We need this vaccination because it will help us stay healthy. It will help us keep our community, family, and friends healthy as well. Make a game plan when you're planning to get vaccinated. Practice getting the shot, for example, with deep breathing and or watching a video online. Ask your child, do you want the shot in your left arm or do you prefer the shot in your right arm? Be honest with your child. You will feel a pinch when you get the shot. So here are some upcoming vaccination clinics at Richmond Public Schools. One is tomorrow, December 1st at Woodville Elementary School. It's tomorrow evening from 3 o'clock to 6 o'clock p.m., ages 3 and up. This clinic would be for the COVID vaccination only. And then on Monday, December 12th at Barack Obama Elementary School from 3 to 6 o'clock p.m., this clinic is for the COVID and the flu vaccination. So we have two upcoming flu clinics, two upcoming vaccination clinics, one December 1st at Woodville Elementary School, COVID only, and the next one is December 12th, Barack Obama Elementary School, COVID and the flu.
All right, I think that is everything. Whew, that was a lot of information. Thank you, Nikisha. Thank you, Dr. Kimbrough, Dr. Perry. We have a few minutes for any questions. So if anybody's watching out there and you do have some questions, don't hesitate to put them into the YouTube chat, and the great team at RPS will pass them along. I have a question that I hear a lot. If one of the doctors could lay out for us, kind of in layman's terms, what are the difference in terms of the symptoms between COVID, the flu, and RSV? Is there really a difference? And if you have any symptoms, really what's the best step to take?
I can take that one. It can be really hard to tell the difference. But all three of the viruses can cause nasal congestion, cough, fever, can make you feel run down. For little ones, they may not feel like eating as much as normal. Sometimes all that coughing can cause some vomiting. Just stomachs don't feel so well when they're swallowing all that yucky stuff. Typically with flu, we do see higher fevers and more muscle aches as a primary complaint. So that can be one thing that helps us know flu versus the other two. But really the best way to tell is with a test. So you can do a home COVID test that's going to help you know if COVID-19 is really the trigger for the symptoms. And then if we are concerned, we will discuss whether we need to do a test in the office, particularly for flu, because we know that there's treatment options available, especially if we start those early in the disease. So doing Tamiflu, for example. So that's another thing to talk with your healthcare provider about, is if your child needs to get further testing, if a home COVID test is negative, but they still have symptoms, so that you can decide on the best course of treatment.
So is there a home flu test? No?
No, unfortunately.
There's no home RSV test.
And for older kids, knowing if it's RSV or not, we don't necessarily have a disease treatment specific to RSV, but it just helps you to know, what again is driving those symptoms, as Dr. Perry said.
Okay, so if you got a fever, kind of achy, not feeling great, maybe take a home COVID test. If that's negative, then maybe go see your primary care physician, or talk to your nurse at the school, and they can help connect you with the right folks, so they can kind of see what's going on and figure out if it's flu, RSV, or something else. Fair enough. I have heard a lot of folks say, do I really need to get the COVID booster? I mean, it's been around so much. I've already gotten it. I've gotten it twice. Like, what's the big deal? We're all just moving on. So Dr. Perry, should folks get the bivalent booster? And full disclosure, I have already gotten mine.
Well, good, because I was going to try and to convince you if you hadn't already. So, and I've gotten mine as well. So completely, again, understand that people are tired, and it seems like, oh, another shot. And many of us have gotten many of them based on the time when we got them and our age and things like that. What's different about the bivalent booster, though, and why we really do feel like it's important for people to get it, is because we know that the COVID-19 viruses that are circulating in our communities now are different enough from the ones that were circulating earlier on, and that the first vaccines protected against, that original shots that we got however many months or years ago, or even just a few months ago in some cases, that protection is not going to be as great with the Omicron variants that are circulating now. And so because this bivalent booster, so two different protection in one vaccine, the older variant, the original variant, and then the Omicron variant, because it's protecting against both of those, it is really shown to be more effective against what we're seeing right now. The other thing too is that unfortunately, COVID-19 vaccines don't last for life, right? We do know that if you get sick with COVID-19, after a while, your immunity to that decreases. Same thing with a vaccination. And not unlike flu, right? We get flu vaccines every year. At some point, maybe we will be getting annual COVID-19 vaccines too as well. We'll see. I don't want to predict that. But it is important that since it has been a while for many of us, because it's different variants that are circulating, and our immune system just doesn't keep us protected that long, that we do go ahead. And remember, it's children down to 5 years of age are eligible now for that bivalent booster. And children younger than that, our anticipation is that approval or authorization should be coming soon as well. Not yet, but for right now, again, school-age children 5 and up should be getting that bivalent booster dose if they've already completed their primary series. And if they haven't done their primary series, go ahead and get that started.
Yeah. Thank you for that, Dr. Perry. And I wanted to reiterate an analogy that I believe Dr. Kimbrough used with the seatbelts. So, a vaccine is not going to 100% protect you. Nothing will in life. But if you wear your seatbelt, the chance of you surviving a crash is significantly higher. And similarly, if you're vaccinated, the chance of you avoiding serious illness and certainly death is significantly lower. And so I know some folks, still are hesitant, but the evidence on that is really, really clear. So want to put in that plug. And then similarly, I've met a lot of people who never got a flu vaccine, and they kind of finally came around to getting a COVID vaccine. But can you talk about the effectiveness of the flu vaccine and why it is in many ways just as important as getting a COVID vaccine?
Right. And we know that because there are different strains that circulate every year for flu, and some years the flu vaccine that is approved for that year is a good fit, and some years it's not a good fit. So when you look at flu vaccine efficacy and effectiveness over time, it's up and down. And to be very, very honest, that some years is better than others. That being said, going back to the car seat analogy, the serious illness, it still is very important, because even if it's not going to be 100% effective and you don't get flu at all, it is very helpful, very effective at reducing the risk of serious illness. So again, that illness that keeps you out of school for days at a time, keeps you out of work, puts you in the hospital, or again, even causes death, right? Influenza is a fatal illness for many people. And so that's why we really still encourage that vaccination, influenza vaccination every year. Again, it's too soon in the season to be sure what kind of a fit it's going to be, but it really is very important for kids and adults to get that flu shot every year.
And is the reason that the fit isn't always great, is that because they have to kind of make a call on the formula months before it actually goes into arms and things mutate in the time being?
It is that because of the production time that's necessary to make these vaccines, any vaccines, but the influenza vaccines, they're making decisions months before they're actually going to be in arms. And in that meantime, things can happen. And so again, a lot of thought and effort and good scientific knowledge goes into it, but it isn't always, it isn't always perfect. So but it's still, even on a bad year, there still is some protection. And that's why it's good to go ahead and get vaccinated.
Great. Nikisha, any final words from the school health perspective? Questions that have popped up a lot that you see in schools?
Well, I will hold you on the line all night if I went through all the questions that we get on a daily basis. But I do want to say, when you talked about the winter break that's coming up, I just want to say take care of your overall wellness, physical, mental health. Do something for self-care. And that goes from staff all the way to our students. Do something that you love. I will also say, depending on the weather, get outside, connect with nature. Those things are scientific proven to help with our mental health. I wish I could have taken a walk today because I did not have a good day at work today. But of course, it's dark now, it's too late. But anyway, but do those things that make you happy and find those little pockets of peace in your day. So, I know we focus on the physical things today, but don't forget the mental things and always focus on overall wellness.
Amen. Amen. Dr. Perry, Dr. Kimbrough, any final words?
Just want to put probably the most common question I hear from families is, can you catch the flu from the flu vaccine? I hear that all the time. And unfortunately, sometimes it's just bad timing, right? If you decide to go out and get your flu shot right now, while the virus is really, really high levels, it takes about 2 weeks to get your immunity. So there's a chance that you could catch the flu before you have that immunity built up. But the flu vaccine is killed virus. You can't get sick from the vaccine itself. So just a plug for that and for folks that maybe have heard that myth out there.
Excellent information. Dr. Perry, any final words?
Now, agree very much with everything that was said. We can't forget the basic public health preventive practices, washing hands, staying home when we're sick. The whole coughing and sneezing into your arm is still important, but we have science and public health science to help us in terms of vaccines, at least for influenza and COVID-19. And so again, very, very strong recommendation that if you haven't started the series, that you start it. If you have, get your booster. And again, that yearly flu shot is so important as well. Thank you.
Excellent. And I want to just put a plug in for hand washing too, as a parent of an 11-year-old and a 13-year-old. 3 seconds of a hand running past water is not washing your hands. So soap, 20 seconds, warm water if you've got it. It's a small thing. I know folks don't always enjoy doing it, but oh my, it makes such a big difference. So we are blessed to live in a world, or rather a country, where we have access to clean water and soap and such, and not everyone has that. And so let's take advantage of that. It's such a huge way to prevent transmission. And of course, the Count Dracula sneezing and coughing is also very, very important. All right, well, look, thank you, Dr. Perry. Thank you, Dr. Kimbrough. Thank you, Coordinator White, and everybody for joining. Thank you to our translation services and to Matthew Stanley and the comms team for putting this together. I really appreciate folks making time to watch tonight. We will also link this in my RPS direct email tomorrow, so folks can catch it there, and we'll have it available in lots of different places. As Makisha said, take care of yourself physically and mentally. Let's have a great, healthy, and happy holiday season. Take care, everybody.